There's a great article in The Guardian that I'm going to do no justice to talking about here, but nonetheless, I'll try. It basically talks about British people who are living in America for work purposes and their experiences with the healthcare system. And by and large, they're confused and angered and amazed. They're baffled by how stupid our healthcare and health insurance system is. So one guy named David Gray is a director in Brooklyn. One year he went for a checkup and he said everything was fine. You know, I went to a nice building and everybody was nice. And then he said the next year he got very sick. He had a chest infection and he was coughing like crazy and he was doubled over and he could barely move. So he dragged himself back to the same place that he had his checkup. And he thought, well, obviously they'll help me here. This is my doctor now. Turns out that when he got there, they basically kicked him out because they didn't take his insurance any longer. They changed it, and he didn't even know that they changed it with his policy. Welcome to the healthcare and health insurance system in America. They say that some people actually fly back to the UK for dental work and doctor's appointments because even with the cost of airfare, it's cheaper to go back to the UK for your health care. Isn't that incredible? That's so sad. That speaks volumes about the way we do our health care here. Quote, they wince, talking about British people, when you talk of friends who pay $11,000 a year for health insurance for themselves and their 3 kids. And to many Americans, $11,000 a year for a family health insurance plan is cheap. Brits find it hard to believe that many Americans stay in a job they hate for 20 or 30 years, mainly because it provides health insurance for them and their families. Again, that's a stunning fact that we don't discuss nearly enough, even on this show. That happens. That a lot of people are like, okay, I need health insurance, but if I leave my job, I don't have it, and I can't afford it. I guess I got to suck it up and stay at this job. Oh my God, it's like a form of slavery in a way, right? I mean, there's wage slavery where you work full-time and you get paid less than you're worth. We have that in America. And you get paid less than you can survive on. We have that in America. And then there's this, which is like a form of indentured servitude / slavery. It's like, well, I'll work here even though I don't want to because I don't want my fucking spleen to fall out my ass. Amazing. It's amazing. So this is my favorite part of the article. When presented with options for care, like a bronze plan or a silver plan or gold or platinum, the British people are like, what the fuck is this? And they're so right because being in an American perspective, from an American perspective, you don't really see this objectively because we're so used to it that we don't bat an eyelash at it. But they're like, when you get sick, you get help. What the fuck does this mean to get a bronze plan versus a gold plan? Like, what are you going to do when the bronze plan person is too sick? You say, sorry, not going to cover that one. Ha ha, get the fuck out. Like, what is this? And essentially what it means is a bronze plan, a lower plan, it's like, okay, you'll pay lesser per month, but then when you actually get sick, you'll have to pay a metric fuck ton out of pocket. And the people in Britain are like, this concept is just ridiculous. Like, we're not buying a car here. We're not shopping for credit cards. Like, this is fucking healthcare. Like, don't you see this is something different? Like, this is in a different category than all this other shit? And again, they're so right in that feeling. And then I'll leave you with this point on this story. Again, this is fascinating. They say, quote, where Americans talk about out-of-pocket and deductibles and copays, Brits say, what? So in other words, just presenting the idea of like a copay or a deductible to somebody who lives in a system where it's national health care. They're flabbergasted. And they're right to be. I've said this from the beginning about insurance, even car insurance, all types of insurance. The idea that I pay you every single month, and then when some shit happens, you turn around and say, oh, that's great. Well, anyway, so I, the insurance company, would help you out, but you pay the first $1,500, and then I'll help you out. Motherfucker, why the fuck was I paying you all these months and all these years then? So I pay you every month, and then when something happens, you go, great. Anyway, you pay the first $1,500. You pay. I fucking gave you money this entire time. What have you been doing with it? We've set it up in America so that all these things are for profit. That's the problem. The problem is that when it boils down to it, there's some CEO at the top of the chain or some CFO or some owner to an insurance company. They have 3 mansions, a yacht, a Maserati, a Rolls Royce, model girlfriends, $50,000 champagne bottles, and they're making money by bleeding people dry. They're making money by trying to weasel their way out of paying for health care. I mean, that's what a for-profit insurance company is, a health insurance company is. The more money they don't spend on you when you're sick, the more money goes to their bottom line, and the better off their shareholders are, and they are. The more profit they make, the more they deny care. It's a terribly perverse incentive, and that's why you see, like in America, we had this problem with entire departments at insurance companies for a process called rescission, which means they look to nullify your contract by any means necessary. So they'll go back in your contract when you get sick and you need them to pay out, say, on your cancer. They'll look back in your contract and they'll go, oh, I'm sorry, Mr. Johnson. Here, you put your middle initial on the contract. Here, you didn't. So therefore, the entire contract is null and void, and we're not going to pay out for your cancer treatment because this contract is not valid. Another example that we've discussed on the show before, this is insane, but a woman had acne, and an insurance company said, we're not going to pay out for your cancer treatment because of your acne. And she's like, wait, but what do you mean everybody had acne? They said, no, it was a pre-existing condition and you didn't tell us. And by the way, you say it's acne, we say it was cancerous skin lesions and you didn't tell us. Therefore, you already had cancer once. That was a pre-existing condition. So we're just going to say we're not going to pay out because you lied to us originally when we made our deal. These are real things that happen in America. We have this system set up, and people in Britain are looking at us like, you motherfuckers, are you this stupid? Like, are you this stupid? You're not marching in the streets right now? Your fucking your government is at war with every country on earth, and you're not out there with pitchforks saying, hey, slapstick, take that money and put it towards our health care. What the fuck is wrong with you? How is it we can afford a war in Syria, Afghanistan, Iraq? We're doing drone strikes in Pakistan and Yemen and Somalia. We have 900 military bases all around the world. 57% of our discretionary spending for the federal government is for war. We can afford all that. We can afford $80 billion plus in subsidies to the big banks, but we can't give health care to everybody in the country. Oh, I'm sorry, that's just how it worked out. We're too busy doing pork barrel projects and corporate welfare and war to give a shit about the people who are paying the goddamn taxes. We are getting fucked. We've been had. It's that simple. The entire healthcare system in America is a scam. It's a for-profit scam where they fuck us out of good care. We spend way too much money, get worse outcomes, and we still have people that die because they don't get basic care. This is not a problem you see in other modern nations because they have single-payer systems. When you pay taxes to the government, they demand that the government do some shit in return for them. Hey, you're going to give us health care. You know that, right? Hey, you're going to give us education. You know that, right? So the government takes the money, but the people demand that they do something with that money that's positive. We're in America. It's like we pay the government to appease the government. Here, take my money and just go away. Leave me alone. Why are you not demanding something for it? Your money's good. Say if I'm going to give you money, you better give me fucking health care. I mean, look, this stuff should be common sense, but Americans, unfortunately, are so ignorant on this issue. They don't research about it. Our media is fucking pathetic. They don't cover this in any serious way. So when you explain to them how other countries are just living essentially in a utopia when it comes to a healthcare system compared to us, they're like, oh, wow, really? I didn't know it was like that. Golly. Well, let's get up and let's fight and let's try to get a universal healthcare system, a Medicare for all system, because that's the only thing that makes any sense at all. Anything else is we're being scammed.